Good morning everyone. In today's class I would like to discuss you regarding the infectious diseases of heart. So here in infectious diseases of heart we are having mainly three types of diseases. So we have endocarditis, we have pericarditis and we have myocarditis. And in this class I would like to discuss you regarding the endocarditis. Coming to the topic, if you see, first of all you need to know what are the layers of the heart, then only you can understand what is endocarditis and what is myocarditis or what is pericarditis. So here if you see the endocardium, so this one, it is the membrane that lines inside the chambers of the heart. So here it is forming the surface of the valves. So if you see here the endocardium, so you can see the endocardium, the inner lining of the heart, this one is called as the endocardium. And coming to the myocardium, this is the muscular tissue of heart. So you can see the portion which is shown you in the red point. So this one, it is the myocardium. So it is the middle part. It is situated between the endocardium and it is situated between the pericardium. And coming to the pericardium, this one is the outer covering. So it mainly deals with the outer surface of the myocardium. And if you see the pericardium, this is the outer membrane. What is this one? This is the outer membrane. And coming to the endocardium or myocardium and pericardium, these are also having some sub layers. I'm not going to touch all those things. That was the anatomy part, so you have to go and read in the anatomy. So here I will say you what is this endocardium. So any inflammation that is coming in the endocardium, it is called as endocarditis. If the inflammation or infection is occurring in the myocardium, then you are calling it as myocarditis, and if it is coming in the pericardium, you are calling it as pericarditis. We'll see what is this endocarditis. The inflammation of the inner layer of the heart of the endocardium, so it is called as endocarditis. So what is it is involving? It is involving mainly the heart walls. So what are the inner parts that are there in the heart? If you see the diagram here, so the inner parts are papillae and the chordae tendineae and the valves and the right ventricular covering. So all these are, what are the chambers that are there? All these are the endocardium. So any kind of infection that is occurring, so it is usually involving what? Heart valve. So, and it is also characterized by a lesion which is called as vegetation. So if you see the picture here, you can observe the vegetation. So the infection is growing on the valves. So this one is called as endocarditis because of the vegetation here, the inflammation is coming out. And due to the inflammation, what is happening? The cells are inflating and they are becoming inflamed, and the condition is resulting in endocarditis. So you can see in this picture also. So this is how the vegetation is growing. How the vegetation is nothing but the bacteria. The bacteria will choose one part, will choose one inner layer part, and it will try to settle down there. It will create colonies. What it will do? It will create colonies, and the colonies will look like vegetation. So you can see the picture here. Simply you can relate it to even the floor also. Whenever you are keeping more and more water on the floor, you can observe some greeny substance. Correct or not? So some growth will be there, some green color growth will be there, and if you place your feet, you might fall down also because of the smoothness of that vegetation which has grown there. In the same way, if you relate it to the physiology of heart, if you come to the disease condition of the heart, here the bacteria will grow on a particular place. So that are the most places that are affected are mainly the valves. So inflammation, the disease in the valves, it is called as endocarditis. And the other structures, so not only the valves, right, heart constitutes of other structures also which are there inside. So as we have said, it is having intraventricular septum, and the chordae tendineae is also getting affected, mural endocardium is also getting affected, and intracardiac devices. What are the intracardiac devices? If you have seen the valvular heart diseases, you will understand what are these intracardiac devices. Whenever there is valve repair is going on or valve replacement is going on, we are keeping the intracardiac devices. And in order to overcome certain types of heart conditions, we are doing so many types of mechanical processes which are introduced into the heart. Means the artificial membranes or the artificial mechanisms, they are kept in the heart. So when they are doing the operation, there are more chances of developing the infection because the patient is exposed to the external environment. So here also you can see the involvement of these mechanical devices. So what are the structures that are getting affected in the endocarditis? Mainly the heart valves and the intraventricular septum, chordae tendineae, mural endocardium and intracardiac devices. So how does this endocarditis happening? So how you are getting this endocarditis means because the bacteria or the form or the germs which are present in the other part of the body. So here if you see the oral hygiene, it plays a major role. So if you are not maintaining proper oral hygiene, and if your mouth is with any kind of infection, ultimately it will spread to the heart, because the blood is the fluid connective tissue. It is connecting each and every part of the body. So with the help of the bloodstream, what it will do, it will go and it will attach to the damaged areas of your heart, and it will start giving the inflammation. So coming to the classification, if you see in the classification of this endocarditis, we have two types. We have acute endocarditis and also we have subacute endocarditis. So it is mainly because of the high virulent organism. So even though the person is normal and the heart is also normal, it will get frequently affected with this disease because of this high virulent organism that is present over here. So it is destructive, it is tumultuous infection, and it is frequently of a previously normal heart valve with a high virulent organism. So here, because of the high virulent organism, the acute endocarditis is seen, and hematogenous lesions also can be seen, and if it is left untreated, the person will go to death within the weeks. And nextly we'll see what is the subacute endocarditis. So here, if you see the acute endocarditis, it is mainly caused due to the high virulent organism. But if you see the subacute endocarditis, so here the organisms are of low virulence, and the infection is mainly to the abnormal heart. So whenever the abnormal heart is there, means any kind of valvular diseases that are being developed or the deformed heart valve, so what will happen, this subacute endocarditis can be seen. Even the low virus can go and cause the infection there, and this disease, it will appear insidiously, and it will pursue a protracted course of weeks to months, means it will stay for several weeks, or it will go even for months also. So whenever the patient is given proper kind of antibiotic treatment, then only the person is coming out. So this is the recovery for this subacute endocarditis. So what is the classification? We have mainly two types, acute endocarditis and subacute endocarditis. This is mainly with the high virulent organism, and the subacute is mainly with the low virulent organism. Acute endocarditis, it is occurring in normal heart, and subacute endocarditis, it is occurring in abnormal heart. And you can see hematogenous lesions, and if you see the subacute endocarditis, the disease will appear insidiously and it will stay for weeks to months. And if you are not treating the acute endocarditis, the person will result in death. And in subacute endocarditis, whenever you are treating them with the correct antibiotic, the persons will recover. Now we'll see what are the predisposing factors. So coming to the predisposing factors, we have cardiac and vascular abnormalities. So what are these cardiac and vascular abnormalities? Means mainly the disease conditions. Whenever the person is having rheumatic heart disease, this rheumatic heart disease, it is the main cause for valvular heart diseases. Whenever the person is suffering from the rheumatic heart disease, automatically the person will land up in the valvular heart diseases, and these valvular heart diseases, they will result in the infectious diseases of heart. They can be endocarditis, myocarditis, or pericarditis. And nextly we have myxomatous mitral valve, and nextly degenerative calcific valvular stenosis. Whenever the valve is getting stenosed because of the calcification, then you can observe this factor, this disease. And also bicuspid aortic valves as well as prosthetic valves. So these prosthetic valves are nothing but the mechanical valves. Whenever the valve replacement has been done, the mechanical valves which were introduced into the person's heart. So these are all some of the predisposing factors which were related to cardiac as well as vascular abnormalities. And if you see the host factors, so what are the host factors here? The persons who are having neutropenia, immunodeficiency, malignancy, and therapeutic immunosuppression. So here the persons who are having some kind of replacements or some kind of organ replacement in the body. So what we will do, or any kind of surgical procedure, in sometimes in order to prevent the rejection of the body, they will give some immunosuppressant drugs. And to various conditions also, various disease conditions also, they are giving the immunosuppression drugs. So whenever the immunosuppression drugs were given, the disease fighting capacity of the body is being decreased, during which any organism which is entering the person's body, it can directly go and affect the particular organ. So in this factor, it will go and affect the heart. And nextly, the persons who are having this diabetes mellitus and the persons who are having alcohol as well as IV drug abuse. So these are some of the predisposing factors for this endocarditis. Coming to the microbiology, so which type of organisms are coming and affecting the heart? So if you see the Staphylococcus aureus, it is occupying about 35% of the disease participation. So either it is a healthy or a deformed valve, or the person is IV drug abuser, so or any kind of devices that are present here, the Staphylococcus aureus are observing. And coming to the Streptococcus viridans, so it is occupying about 32%. It is native, but it is present whenever the heart valve is previously damaged or if the heart valve is abnormal. And Enterococci, it is occupying about 8%. Coming to this coagulase negative Staphylococci epidermidis, it is occupying about 4%. So they are believing that mainly this prosthetic valve endocarditis or any kind of other devices, this coagulase negative Staphylococcus, this group of organisms are most responsible for frequent and early infection in the heart whenever they are going for replacement. And actually gram negative bacilli, so mainly the HSEK group, it is occupying about 4%, and yeast and fungi, it is occupying about 1%, and culture negative endocarditis, it is occupying about 5%. So this is the microbiology of this endocarditis. Coming to the pathogenesis. So if you see the pathogenesis, because of any kind of dental or surgical procedures or using the contamination of IV drug use. So whenever you are giving the IV drug, as a nurse, it is your responsibility to maintain the sterile techniques, because the person, because of the unsterility, because of your negligence, there is more chance that person may experience some kind of dangerous diseases such as endocarditis or infectious diseases to heart. And nextly, the person who is having any kind of skin infections or the occult source from the gut or oral cavity or trivial injuries or intravascular catheter infection. So whenever you are going for IV needle, IV catheterization, so during that also, as a nurse, it is your basic responsibility to maintain the aseptic conditions. And nextly, nosocomial wounds and chronic invasive procedures. So these are all some of the factors which will result in the endocarditis. Coming to the pathophysiology of this endocarditis, if you see, mainly whenever there is endothelial injury, so there we can observe uninfected platelet fibrin thrombus. So what you will call this one is non-bacterial thrombotic endocarditis. So here the transients bacteremia which is present there, it will come and it will attach to this thrombotic which is formed over there, and you can observe the proliferation and procoagulant state, and later it will go to the infected and fibral and bulky vegetation. So the endocarditis can be seen over here. So what will be there? Firstly, whenever there is endothelial injury, the non-bacterial endocarditis will be formed. So the bacteremia will come and attach, again the further proliferation and procoagulant state it will undergo, and finally it will result in the infection, and you can see the bulky vegetation. So you can see here this one is friable bulky vegetation which is containing fibrin and inflammatory cells and microbes. So you can see the infection which is present over here. So this is how the infection will come. So here mainly the aortic valve and the mitral valves are most commonly involved. So as you can see the infection over here, I was trying to highlight it. This is how you can see the inflammation in the heart. Coming to the signs and symptoms of this endocarditis, the person will experience fever and chills. You can hear a new or changed heart murmur. You can observe fatigue, and the person will experience pain in the joints and muscles. You will have night sweats, and also you will have shortness of breath. You can observe paleness, persistent cough will be there, swelling on the feet and legs and abdomen can be seen, and there will be unexplained weight loss, and you can also observe hematuria, nothing but blood in the urine. You can observe the tenderness in the spleen, and you can also see the Osler's nodes and the petechiae. You can also observe petechiae. Petechiae are nothing but you can see the petechiae in the dengue condition also. So here you will find some red spots on your body. So they are ready to bleed whenever there is some kind of platelet dysfunction. So you can also observe the petechiae. So these are all some of the clinical symptoms of signs and symptoms of the endocarditis. Coming to the risk factors. So what are the factors that are favoring the disease? Means mainly the artificial valves, congenital heart defects, history of endocarditis, damaged heart valves, and history of intravenous illegal drug use. So the persons who are going for drug abuse, what they will do, they will self inject the medicine, they will self inject the drugs which will cause this endocarditis. Coming to the complications, the person may experience stroke, or there might be organ damage, or it will result in the other infections or other body parts infection, and sometimes it will even result in the heart failure. So what are the blood investigations that we will do? Means we will go for blood test, we will go for transesophageal echocardiogram, and also we will go for electrocardiogram, and we will go for chest x-ray, and also we can see the CT scan or MRI scan. Coming to the diagnosis and investigations that were performed in the endocarditis, we have blood investigations, and also we have transesophageal echocardiogram, and they will also go for the electrocardiogram. Chest x-ray will be taken, and CT and MRI scan also can be taken in this endocarditis. Coming to the treatment part, so if you see the treatment part, we have antibiotics. So first line of treatment in the endocarditis, and surgery. So if the infection is damaging the heart valves, so here during this condition they might go for valvular replacement. So we'll see what is the antimicrobial therapy here. So here this therapy, it is requiring the specific identification of the pathogen. So they will go for blood cultures, and whenever they are going for blood culture, they can know, they can understand what was the organism present over there, and for which thing it is susceptible, and for which medication it is resistant. So based on that they will start the treatment. So empirical therapy should be started as early as possible, and bactericidal drugs should be used. It means the drugs which are having the capability to kill the bacteria, those type of drugs can be used. So here you can see the fever, it will reduce within 5 to 7 days, and if the fever is persisting, if the fever is still persisting, the patient should be evaluated for further complications. So complications such as paravascular abscess or extracardiac abscess, so they have to go and check for those things, and they also should go for serologic abnormalities. If anything of, or if any serological abnormalities are present, so it should resolve slowly, and it should not reflect the response to treatment. Coming to the antibiotic regimen, here if you see, if it is streptococci, they will go for benzyl penicillin, which is 1 to 2 grams, and it is given 4th hourly for 4 to 6 weeks. The other medication for streptococci is gentamicin, which is given 1 mg per kg body weight, and it is given 8 to 12 hourly for 4 to 6 weeks. So 8 to 12 hourly means it can be given for TID, or sometimes it is given for BD. And if it is if it is benzyl penicillin, 1.2 grams 4th hourly they are giving for 4 to 6 means nothing but daily they are going for 4 to 6 times a day based on the disease condition. If it is enterococci, then and the patient is ampicillin sensitive, so they are going for ampicillin, which is given 2 grams 4th hourly for 4 to 6 weeks. And if it is gentamicin, 1 microgram per kg body weight for sometimes TID dose or BD dose. And nextly, ampicillin resistant, if the patient is ampicillin resistant, then they are going for vancomycin and gentamicin. If it is vancomycin, it is 1 gram 12th hourly for 4 to 6 weeks. If it is gentamicin, 1 mg per kg body weight 8th hourly or 12th hourly for 4 to 6 weeks. If it is staphylococci and the patient is penicillin sensitive, they are going for benzyl penicillin. If the patient is penicillin resistant, they are going for flucoxyxylin. If the patient is both penicillin and methicillin resistant, again the drug of choice is vancomycin or gentamicin. So you just try to take a screenshot of this medication so that you can write in your notes, so you will have some sort of idea. So you need not to write everything here, just if you mention 2 to 3 drugs, that is enough. Coming to the surgery, so here the patients who are having the direct extension of infection to the myocardial structures, so there you are going for the surgery. If it is prosthetic valve dysfunction, then you are preferring for surgery. If it is congestive cardiac failure or heart failure, you are going for surgery. If the valves are very badly damaged, then you are going for surgery. And if the infectious endocarditis mainly caused due to fungi or gram negative organisms or any kind of resistant organisms to the drugs, then you have to go for the surgery. And large vegetations on echocardiography, if you are seeing, then also you will go for surgery. And recurrent embolic attacks also you will go for surgery. Coming to the prophylaxis, so what is the high risk category means the persons who are high risk of getting this endocarditis or infectious heart diseases, means the persons who are having prosthetic cardiac valves and the persons who are having previous bacterial endocarditis. So even though there is absence of heart disease also, these persons are at high risk, so you have to go for prophylaxis. And complex cyanotic congenital heart disease also you have to go, and surgically constructed systemic pulmonary stents, so during this time also you have to go for prophylaxis. And the people who are moderate risk category are the persons who are having rheumatic heart disease or valvular dysfunction, congenital cardiac malformations or hypertrophic cardiomyopathy, or the persons who are having mitral valve prolapse with valvular regurgitation. So all these persons, they are moderately risk. How to prevent this endocarditis means mainly you maintain dental health, avoid piercing and tattoos, and you should seek prompt medical attention if you develop any kind of skin infection, or if there are any cuts, or if there are any sores that do not heal properly, you need to go for medical attention. And coming to the preventive antibiotics, so here in preventive antibiotics mainly we are going for oral regimen. So amoxicillin they are giving 2 grams 1 hour before the procedure, whatever they go. Or if the persons who are not unable to take the medication amoxicillin, they are going for ampicillin. So 2 grams IV or IM 1 hour before any kind of procedure. And if the person is penicillin in allergy, so we are giving clindamycin or clarithromycin or cephalexin. So clindamycin it will be 600 mg, or clarithromycin we are giving like 500 mg, or cephalexin we are giving 2 grams before the surgery, 1 hour before the surgery. Here what are the persons who are going for artificial or prosthetic valve or previous endocarditis infection. So this is regarding the preventive antibiotics. So with this I would like to end the session here. This one is also the same thing which I have discussed earlier. What are the antibiotics that are recommended before the procedure? So whenever you are involving any kind of procedures which is involving the respiratory system or infected skin or tissue that connects the muscle and bone, then you have to go for the prophylaxis treatment. So this one is the preventive antibiotics mainly. What are we using? Amoxicillin, ampicillin. If they are penicillin allergy, we are going for clindamycin, clarithromycin and cephalexin. Thank you so much. Thanks for your patience. So with this I would like to end the session here. I will say the nursing management. Nursing management will be taught you in the next coming classes. I will explain you what is myocarditis and pericarditis. Then we'll see what is the nursing management. If it is possible, I will try to explain in the coming classes also. And if you have any queries, please drop them in the comment box. So thank you so much. Thanks for watching. Please like, share and subscribe.